Hello, everyone. So we're going to talk about smoking, and it'll make sense in a little bit why there's this background behind me. So using data from scientific sources such as the CDC and Arkansas Department of Health, which is actually just next door, how do cigarette smoking rates in Arkansas compare to U.S. rates? Um, so this is keep it brief, so I'll try to do that. Using the current data, here's just a brief overview. Smoking prevalence is generally higher among younger adults with significant rates among ages 18 to 24 years old. And as far as race and ethnicity, smoking tends to be higher among non-Hispanic whites and Native Americans compared to other racial and ethnic groups. Men are more likely to smoke than women, although the gap has been narrowing recently. And specifically to Arkansas in 2014, about 39.5% of cancer deaths among men in Arkansas were attributable to smoking. And that was from a study by Lortet and Thielen. And this is an example of 10,000 people in the stadium behind me. It's the Ann Arbor, Michigan stadium. And 39%, if we're taking the 2022 data, would be about 240,000 people a year that die due to smoking. So that's really sad. Just think about that would be 2.4 of these stadiums due to smoking. So the prevalence of current cigarette smoking among adults is 15.5% in 2016, with higher rates among certain subpopulations, such as those living below the poverty level and those with less education. So based on what I've learned in the class, I'm supposed to talk about the results that I found, and number one, from an epidemiologic perspective. So the high smoking rates in Arkansas compared to the national average, I think can be attributed to several factors, including socioeconomic status, education levels, access to tobacco cessation resources. And the data highlights the importance of targeting public health interventions to address these disparities. So the next question is, aside from the well-documented role that the tobacco industry played, why do I think the cigarette smoking and tobacco-related products remain a leading cause of morbidity, mortality, and disability, even for 50 years after the evidence that it caused lung cancer? So despite the dangers of smoking, a few factors I think contributed to the persistence of it. So number one is addiction. Nicotine is highly addictive, making it difficult for people wanting to quit. And we've learned a little bit about that in regards to like the pre-contemplative stage, the contemplative stage, and all the challenges that people go through just to stop addiction. So social and cultural factors are another one. It's often socially and culturally ingrained, especially in certain communities and populations. So economic influence has a play in that. So the tobacco industry's influence in advertising and lobbying continues to affect public perception and policies. And also it's related to mental health issues. So higher smoking rates are observed among those that have higher mental health self-reported issues or challenges, and that can be a contributor as well. So a few articles that support those thoughts are an article that's called Adverse Childhood Experiences in Cigarette Smoking, and the other is Epidemiological Evidence on Count Process and the Formation of Tobacco Dependence. So the next question is, reflecting on Unit 13, Association and Causation, what type of cause do you think best describes cigarette smoking and why? So I think that cigarette smoking best describes a sufficient cause. So smoking alone can lead to diseases such as lung cancer, but other factors as well, like genetic predisposition, environmental exposures, can also contribute to the disease development. But the presence of smoking significantly increases the likelihood of these diseases. So the next question is, think about how much time public professionals in the medical community spend on trying to figure out what is the cause of a disease. We as health professionals always think that if we just knew the cause of a disease, we could prevent the disease from happening. But is that really true? What other exposure, disease, outcome relationship do you see in public health today that is following a similar path of cigarette smoking and lung cancer? So like 50 years from now, what public health issue will we still be working on in spite of the fact that we know the cause? And this is explain why. So one exposure disease relationship following a similar path of cigarette smoking and lung cancer is obesity, and especially type 2 diabetes. So despite knowing the causes of obesity, like diet, lack of physical activity, prevalence of obesity-related diseases continues to rise. And factors contributing to this include the food industry, so like marketing of unhealthy foods and drinks, and the socioeconomic factors, so similar to what we described earlier. Limited access to healthy foods and opportunities for physical activity in certain communities. My brother gave a little article, or wrote a little article about this, about gym access, comparing different populations that have access to it as an example. So behavioral factors, challenges in changing long-term dietary and exercise habits. So 50 years from now, obesity-related health issues are probably going to still remain a significant public health challenge, despite our understanding of these causes. And I think it's also important to look at history. And I mean, throughout history, there have been times when smoking and other, or even food consumption have been passed down as being something that's not generally healthy in a society. An example is in 1830, there's something called the Word of Wisdom that talks about not having tobacco and tea and coffee and alcohol. And there have been certain studies that have come out to show that these are unhealthy after the fact of those traditions being passed down from just past experience of using substances and addiction in a society. And so I think it's helpful to look at the historical narrative as well, in addition to the scientific literature. So thanks for watching, and have a great day, and don't smoke.